Welcome to Start PT Now podcast, and to let you know what's going on in your world and my world, your guy, my guy, right guy.
Really awesome guest here today. We're joined by Dr. Nikkhah of Pike District Smiles. Thank you for joining us.
Oh, my pleasure.
Well, first and foremost, we were happy to get some insight from a dental professional and how the two worlds between dental and physical therapy collide. What are some of the things that you see in patients that require maybe a physical therapist to be part of your program?
Yeah, so as you all know, I treat patients for dental pain and jaw pain. And a lot of times the jaw pain comes from some kind of joint or muscle dysfunction. And a part of it is what I can treat, and a part of it is what can be treated by physical therapy. And if you want, I can go more in depth.
Oh, absolutely. We want to hear the insights of how the PT world benefits your world, and more importantly, how patients can recognize certain things that may need different treatments than they're accustomed to using in your world.
So there quite often patients experience jaw pain. Unfortunately, it's not uncommon. And of course, it's not something that they can diagnose themselves, but once they come to me or a dentist, we can, based on their symptoms and doing examination, determine if this jaw pain, a lot of patients refer to it as TMJ. It's known as TMJ, but really it's TMD. So TMJ is temporomandibular joint. We all have it. TMD is temporomandibular disorder. So a lot of times when you have jaw pain, it's coming from that joint disorder. And long run, it causes muscle fatigue. So the muscle that is helping us with chewing food gets also very tight and painful. And that's where physical therapy comes in handy. So these patients with muscle fatigue, muscle pain, or if they have, TMD, I can refer them to physical therapy. And with some sessions of physical therapy, they can, learn to do some muscle exercise. Sometimes if the physical therapy doctor thinks it's appropriate, they can get some dry needling and other types of treatment that can make a really big difference in terms of their pain. It can alleviate the pain and really improve their quality of life.
That's the most important thing as healthcare providers, is the quality of life for your patients. Now, on the TMD, and thank you for explaining both the TMJ and TMD differences there, because I think a lot of people think they know what they're talking about, like a sciatic nerve pain.
Yeah.
So it sounds like in your world, the TMD is the proper way to diagnose it. And what are some early signs of TMD?
So that's a very good question. It could be things like that kind of like sharp shooting pain in the morning when you wake up in your jaw, or with that first bite of breakfast, kind of like ouch. And you have to give it a little bit of time. It just seems like the muscles are so painful. Another sign is if you have limited jaw opening. Also, if like you wake up and you're fine, but over time, as the day goes by, you feel kind of like a sharp shooting pain in your jaw. And usually it's not, you cannot pinpoint to a tooth. It's kind of like in a general area of your jaw. Usually it radiates into your lower jaw, but in more severe cases, it can radiate to your forehead, it can radiate to your upper jaw. So you can see it can really affect your life. Sometimes it's even with years of jaw pain, you can also get tooth sensitivity as well.
Absolutely. And talking about TMJ and the effects that can have on someone, I was curious to know what are some of the most common instances that you find yourself as a dentist referring to physical therapy?
So a lot of times when there is jaw pain, physical therapy can make a really huge improvement. So it could be just that sharp shooting pain. It could be clicking of the jaw or jaw popping. All of those symptoms can be treated by physical therapy.
I'm very curious. Now, in your world, I'm sure you've seen a bunch of different situations where the jaw is not only needs a physical therapist, but also maybe some other equipment that may be used for such treatments as TMD. Do you use any specialized equipment for your patients that helps a therapist kind of help them do their work a little easier?
Yeah, so we really have to see where this whole TMD came from. Sometimes it's due to malocclusion of if their teeth don't fit together very well. In those cases, we also treat those patients orthodontically with clear aligners, Invisalign, and basically get their teeth out of trauma, because if the teeth don't fit together very well, it also affects the joint and muscles of chewing. In very extreme instances, if the joint completely pops out of place and patients are having a very difficult time chewing food, then we might have to send them for surgery. But that's not, thankfully, that's not very common. Yeah, and in some instances, sorry, if like they also grind their teeth at night, then we might also fabricate a night guard for them as well.
Teeth grinding is a very common symptom. Is that something that can be helped with physical therapy? Is that caused by weak muscles? What I'm always curious, what causes someone to grind their teeth at night?
Stress.
Okay, that's a
But
big one.
so they're basically, stress is the big one, but also sometimes and it kind of like, it's a vicious cycle. So basically sometimes there isn't enough room in their mouth, like their teeth are so crowded together, the arch is narrow. Then when they sleep, the tongue falls back in the throat. So in order to grasp air, patients tend to grind their teeth. So in these cases, we basically create more room orthodontically. So they don't have the problem with tongue falling back in their throat. So that kind of fixes grinding. But because it didn't happen overnight, they've been grinding their teeth for many years, at least a year usually before they come to us. So it does a little bit of damage to the joint and muscles of chewing. So those muscles are so tense, so exhausted that they need to be, they have to go through physical therapy to kind of like loosen them up a little bit. And so this way they don't have so much pain, basically.
Yeah, and you talk about this jaw pain. It's definitely something that we see consistently in physical therapy. Each week we have different patients coming in for, like you said, the TMJ or the TMD disorder, and just working through them on that. I did want to ask, in your experience, having that direct line of communication with both the therapist and the patients you're seeing, how have you found their feedback to be as far as their physical therapy experience?
Yeah, have you seen a success rate higher with using PTs versus maybe not using PTs?
Definitely. So far, any patient that I've referred to physical therapy, they've basically reported significant improvement. Some of them said their jaw pain completely went away. Some of them had, it went from 10 to 2 or 3. And that's the goal, because sometimes there's so much damage done to the joint that, that damage cannot be undone, but the goal is to improve the quality of life. So it's something that they can live with. And they also learn these exercises. So, so far, everyone that I've referred to has been happy and satisfied, and they continue to do the exercises at home and are very happy with the result.
Looking ahead at sort of like emerging trends in the industry, I know, the physical therapy space is always changing. I was curious on your end with, the world of dentistry, have you seen any emerging trends or techniques that, are sort of changing the way that you work with patients?
Yeah, so with the help of 3D scanning, now we're able to, take these 3D models of patients' teeth and evaluate their bite, because in the past, patients would complain of jaw pain or just fractured restoration, and we didn't really know what was happening. But with the help of 3D scanning, now we're able to evaluate the bite and see where the problem is coming from. So it has definitely helped us have a more comprehensive approach to dentistry, and instead of just treating the problem, like the result, treat the cause of the problem, like see where it's coming from, why they're having jaw pain, why they're fracturing, the restoration, things like that.
Now, on a lockjaw situation, I've heard the term, I don't know if it's the correct one, but when someone's yawning, sometimes it can feel like a lock in the jaw. Is that something that's due to just weak muscles around the jaw area, or is that something a little bit different?
So yeah, that's basically coming from just years of misfitting teeth together. Like if for some reason there are all these different types of misalignment of the teeth that basically put our teeth and the joint in trauma. So when it happened over many years, the jaw eventually kind of like starts popping out. And at the beginning, it pops out and pops back in, but at some point, it just can't. The muscles get so fatigued that they can't help the joint pop back in. And that becomes a really big problem. So in cases like that, there is definitely medical intervention needed. So we want to correct the bite to get the teeth and the joint out of further trauma, but also sometimes surgically we have to put the jaw back in, but those muscles also have to be treated because they've gone through years and years of being overused and just fatigued.
Do teenagers, when they're developing into a more mature level, is that a time when they should be more conscious of the muscles in their jawline and recognize certain things as they get older to strengthen, or perhaps recognize as a preventative measure?
It's pretty difficult, especially for teenagers, that the last thing on their mind is their oral health to recognize these things. But the best way for, monitoring everything, making sure that muscles, teeth, joint, everything is developing properly, is to make sure they get regular dental checkups and cleanings, because all of those will be checked, evaluated at each dental appointment. And if any intervention is needed, they're treated properly.
Just want to thank you again so much for taking the time out today and answering so many of these great questions, providing your insight and expertise. I did have one quick question, shifting over back to the physical therapy world. I know you had talked a bit about sort of like, the success you had seen and sort of like that communication and collaboration with physical therapists. I wanted to ask what advice you had for other healthcare professionals looking to establish effective partnerships between dental and physical therapy practices.
So I know that us dentists, we love to give our patients a night guard. Any type of jaw pain, we just automatically say, oh, you need a night guard. But really, a lot of times, and I say this with confidence, a lot of times a night guard is not the answer or is not enough. You got to think about these patients, their joints and their muscles have gone through years of trauma, whether it's grinding or misalignment of the teeth. And all of these patients really benefit significantly from physical therapy because they, with help of physical therapy, the muscles can gain strength again. And also patients learn to do so much useful exercise at home for those muscles. And we can minimize the amount of ongoing trauma to the joints. So it's very important that they identify the problem, where the pain is coming from, and really add physical therapy for those joints and those muscles as a part of their treatment. Night guard is not always enough.
And for everyone listening today, please visit PikeDistrictSmiles.com over at 11400 Rockville Pike, Suite 106. To learn more on how to help with any dental disorders or pain you may be having, please visit them again at PikeDistrictSmiles.com.